Good afternoon, everyone. Gareth Presh, founder of the World Health Innovation Summit. I'm delighted to welcome you to our WIS Talks today as we discuss healthcare in Africa and the Sustainable Development Goals. Let me introduce our guests who are with us today, experts in their field, but also those who are implementing the SDGs on the ground and those who have that vision and passion to make a difference in our society. Let's go to Dakwin, who's actually a representative from Kinshasa, who's in Washington at the moment. Professor, it's delighted you can join us.
Hi, Gareth. Thank you. It's a pleasure to be here.
Please tell us who you are and what you're doing in Washington at the moment.
Oh yeah, well, great. I'm Dakwin, like you can see. I'm from the DRC in Kinshasa. I'm based at I'm basically an associate professor at the university in Kinshasa. I'm also involved with the National Institute for Biological Research, INRB, in Kinshasa. So as such, we have a few collaboration projects with international institutions. That's why I'm here to do some work with some of our partners. But I should be back home very soon, and I'm looking forward to continuing what we left off from there. So that's basically
Fantastic. Let's go to London and Zainab, who's a student, who's a founder of Somalian Health. Delighted to welcome you, Zainab.
Thank you. Hello, my name is Zainab, and it's a pleasure to be here today. I am a co-founder of Improving Somali Health Awareness, also known as ISHA. And the main aims of our organization is to essentially try and dispel the misinformation that's been going around, especially with coronavirus and the COVID conspiracies, and to empower the Somali people, with the British Somalis specifically, to empower them and to help them to make better guided decisions about their health.
Fantastic, Zainab.
Thank you.
Thanks for that. And Dr. Mwande, delighted you can join us. Please introduce yourself and give us a bit of background.
Okay. Hello. My name is Nasibu Mwande. I'm from Tanzania, but I live in the UK. I work in the NHS as an emergency medicine physician in Cumbria. And at the same time, I'm the vice chairman of the Tanzania UK Healthcare Diaspora Association, or TUHEDA, which mainly is just to capitalize on the benefit of the diaspora to give something back to their community where they live in the UK and in Tanzania. So just shared learning to empower communities with information and the right information and education to make it good choices for their health. So yeah, that's what we do.
Perfect. Thanks. Let's go back to Washington, and also let's have a bit of a context in terms of the DRC, Democratic Republic of Congo, Kinshasa. It's one of our cities actually for the SDG program. Delighted to welcome Dakwin to give us a bit of a context. Maybe you could tell us a little bit about what is it like African healthcare from the DRC's perspective. It would be great to just have some context.
Yeah, great. Thanks, Gareth. Actually, it's in the DRC, the situation is quite complex. I guess it's the same for most countries in the region. We do have access to healthcare, but it really does depend on who the patient is. Does he have enough resources to pay for it? So there are different, very large gaps between what is available and what should really be. There are healthcare systems with hospitals which are well equipped with doctors. There are many others. The majority that is available to the majority of the population is small healthcare centers, whereby the villagers or people in the rural communities can go just get basic healthcare. But when it gets complicated, they really have to be evacuated to bigger hospitals, which are long distance away from where they live, and that's not very practical. It makes it very complicated. That is why I think with the current administration, there is a large will to implement a one Earth system, whereby this kind of differences could be improved to try to shorten this gap and make healthcare available at least to the majority of people, bit by bit, until everybody gets better. But I think it will take quite a bit of time before it does. but I'm optimistic.
It is a big opportunity, isn't it, in terms of learning from around the world? If you look at Western society, even Eastern medicine, there's a huge opportunity for Africa to really gather that knowledge and wisdom. I mean, your role in Washington at the moment, even this conversation that we have at the moment, it's a great opportunity for the DRC and the administration there to really drive a positive change agenda towards good health and well-being, isn't it? You know, because you have a huge need.
Exactly. I think it's like you said, the needs is there. It's a huge need. We just need to be able to realize that nothing will be done if we don't do it ourselves. So we have to make the efforts and make things happen, really. Not just talk, but really do things that are practically solving real issues on the ground in the country. And well, like I say, that's one of the reasons why I'm here. We are trying to improve our capacities to address infectious disease problems we have in the countries. We do have quite a few epidemics, like mainly Ebola and other diseases that come up and go. Right now, we have the measles epidemic that has been going on for a while. Many kids are dying and sick. So we are trying to improve our abilities and capacities to really address these questions with science and research, and really solve these questions from the ground, not from elsewhere and importing the solutions.
And that's such an important point. And let's go to Zainab, because I think she's a real initiator of change, positive change, taking the bull by the horns. Tell us about the Somalian initiative you've launched and how that's supporting local communities with misinformation.
Yeah, so I first initially started this project as a health literacy project, not specific to any country, but to tackle misinformation within several ethnic minority groups. As such, I've been speaking with other people in my university or other students that I know, and we've each templated this project, Isha, to their ethnic minority groups as well. And so essentially with the Somali version, what we're trying to do is empower every single person that watches our content to make better health decisions. And with that, we can actually allow them to think. We're not trying to be magical people and make everyone healthy again. Our goal is just to let people rethink and actually double check information where they get it from. And when we do this, we can empower them. And by doing that, it allows us to strengthen people here and back home. So our videos, when we promote our videos, it inevitably goes to back home in Somalia and within Somaliland as well, any Somali speaking area. And what we find is that people actually start to doubt what they hear on the news or what they hear on the WhatsApp or social medias. And we get messages about people saying, thank you, I didn't know this, or I didn't realize that this was a dodgy source, and so on and so forth. So it really is inspiring to hear that people are now taking our work and trying to, make better decisions about their health, and hopefully it can just grow and keep growing. So yeah.
And that's fantastic, because you've taken the initiative, but it shows that you've taken that self-responsibility to look after your own communities. And as Dakun was mentioning, the huge need that's there. Let me bring in Dr. Mwande, who is, supporting the dysphoria from the UK NHS, but also helping back in Tanzania. The opportunities here, Naz, in terms of for African healthcare, we've spoken many times about how Africa can embrace good health and well-being. The digital means that Zainab has just spoken about, that shall we say, that this information that can be nullified. Where do you see the opportunities for Africa in the next few years in terms of investment opportunities as well?
Thank you, Gareth. I think we just have to remember that change does not just happen; it is meant to happen. And I think the opportunities, they're huge for Africa. And I think with using the diaspora, because we know the situation back home, because some of we work there, we live there, we know how the situation is and what is available and what is not. And now we have the opportunity to work in the West, so where things are being done differently. So we have the best of both. So we want to do what they call the shared learning. So what we learn here, we share with our people, just like Isha guys are doing. That's giving the right information in the language that people can understand, because that's very, very important, because and they also have to be very culturally sensitive, because those, even though we have the same problem, we have some minor thing in our culture. So the cultural understanding is very, very important. So we have huge opportunity to go, but the main thing is to listen. What do the people want? What matters to them? And I think if we start from there, I think we can make a much better decision in terms of investment. And probably, if you listen to them, may not be more expensive. Maybe sometimes what people need is the right information to make those options better for themselves.
And I think that's a key point. If I go back to Daku in Washington, you are there on the basis of learning, but then going back to Kinshasa and listening to local people, the need. Roland Schatz just came back from Kinshasa, and he's had meeting with government officials there, and we have engagement. We want to learn locally what are the needs, part of the SDG program. Do you think that that's an opportunity to engage with citizens, particularly now at a time of misinformation? Is there an opportunity for local agencies within the health sector to work within the context of citizen engagement and use it as a resource of learning? Like, this could be a real opportunity.
Yeah, just to go back a bit about what Zainab and Dr. Nasibu said, I think those are really key points, which would have to be addressed to really be able to improve the situation. That's something I've written about in a few of my opinion articles. The fact that most of the time, what we call in Africa the elite, I mean the experts, they communicate at a level that's not accessible to the people, the real people on the ground. That's really suffer from the situation. So it will have to be something that has to be improved. The ability of the people, the doctors, the health experts, the politicians, to really communicate in a way that people, the real people on the ground, will really catch what's the importance of understanding the role in all the reforms that are being done, and what they can do, what they must do actually if they want to see the situation improving. I always think personally that you could take 100 people, put them at the office of the president or in the government, whatever they do, if the people on the ground do not respect the measures, or if they do not improve on what they do every day with the help of the government, of course, nothing will really change. So coming back to the opportunities that are available, I think, yes, there are a lot of opportunities for whether international or national organizations to really come and help with improving the knowledge, understanding for the people on the ground, understanding the situation and the role they play. And in that optics, actually, with a few colleagues, we also created an NGO locally where we try to make available knowledge, understanding of the situation. We have recently been discussing about COVID situation, because there are a lot of misinformation, especially with the vaccine now. A lot of people do understand things completely wrong, and with social media, things are not made easy. But that's actually the opportunity that has to be addressed and try to help in that sense. Yeah.
And I suppose it's a two-way process, so that those Western societies or whoever it may be that comes can learn also, because I'm sure there's practices. I've no doubt that there's practices in Kinshasa that can be transported to the UK, for example, or to Mumbai, because there are things, I'm sure there's cultural things as well that can be transferred across that we can learn. I mean, the whole process here is about shared learning. I wanted to ask Zainab, because you are kind of, this area, and Dr. Mwanda is doing it as well, in terms of the digital footprint and the opportunity digital means gives us now. It's really important. Could you just tell us a little bit about the misinformation and how you circulate that through social media? How do you get into that pocket, of getting that right? Maybe some tips even for those listening. It will be really helpful.
Yes, so essentially the first place we had in terms of the Somali community near me was WhatsApp. WhatsApp was the main like brewing pot, you could say, of all the misinformation of people that were living around us. And then a step further would be what we saw on Instagram and then what we saw on YouTube. So essentially what we did first was I just messaged back to anyone that I know with facts and telling them to read articles, but obviously everything was in English, so it wasn't very helpful. So that's when we decided to come together and put our brains together to make these videos all in Somali, to hire Somali academics, to do webinars, to do talks. Essentially what we do is we post them on all social media platforms, not to leave anything out. And then we just promote our content, we just run ads. And what we do is essentially make the thumbnails very engaging. And I think that's what the biggest difference is with the newest generation. If the thumbnail is not interesting, no one's going to click on it. And you need to make the title very interesting, have shocking facts and stuff like that, to really get on with the trend. Because unfortunately, what we find is the important information is boring. And that's what makes people not so interested to learn the facts. And they will do anything but go and read that. So if we make the real facts and the real facts and articles very interesting, then we can find a way to fight that. So, yeah.
Yeah, and it's also, isn't it? It's the encouragement of being patient as well. Like, you know, to understand the person who's on the other side. Will they understand that information? And also, I suppose it's worth pointing out that not everyone has a digital means. You know, there is such a digital divide. I suppose that's quite prominent in Africa. Naz, from your perspective, could you tell us a little bit about Tuaida's work? Because I know you're very much at the forefront of trying to mobilize that knowledge from dysphoria individuals around the world to help bring back that knowledge transfer and wisdom. I suppose there'll probably be a huge opportunity in that space in the future.
Yeah, definitely. I mean, that's what we just like what Zainab they're doing. Just try to we have a lot of webinars during the pandemic, both in Swahili and in English, because most of our talk, some of them they are in Duolingo in a way, because we have different audiences. Some people in the UK and some in Tanzania and the other part of East Africa. So what we have done is just try to dig out the right information in a very simple language that they can understand, and just cascade that to them. So we put on our website and our YouTube channel, and then we share small clips in the on WhatsApp as well. So it goes around, and the people you get messages back. Okay, that is fantastic. That's even people in higher places they follow what we do, and which is reassuring. So I think information is key, and I think the information should be coming from reputable sources, and you should give the people where to go and dig that information from, who to listen to, because you cannot just depend on WhatsApp and stuff you see online, because some of the stuff is very technical. People they know just one word in that, and they take that literally. So I think it's very, very important. I mean, giving people information in that language that they really understand, with their tongue, like Zainab is doing. So we do the same as well.
Fantastic. Let me go back to Declan for a second, because I wanted to start asking some questions here around. So what is it you think Africa needs? What is it that can help? I mean, and I ask it sincerely from the point of view. I mean, it's not necessarily finance. It's really, wisdom, knowledge, partnerships, real partnerships where there's a collective will to get things done. I'd love to hear what you think from an African perspective, from the DRC's perspective. What do you think is needed to have that transformational change, which ultimately leads to good health and well-being? Because Africa, like the rest of the world, is going to suffer from shortfall in staffing, for example. Nursing numbers are dwindling, and we have an 18 million gap by 2030. Not many people will know that. And that's an alarming number. And I did a recent report on Nigeria where 40,000 health professionals provide care to nearly 200 million people. I mean, that's huge. So I mean, what do you feel? But that's also an opportunity in terms of community engagement. If we get the initiatives like Zainab is talking about with digital communication, that could be a big opportunity for Africa, to transfer primary care into a preventative measure. So please tell us what your thoughts would be.
Yeah. Look, honestly, I think the needs in Africa are a little bit, it's complex, but it's not exactly the same. It's slightly different from country to country. There are countries that are a lot more advanced, like South Africa, compared to other countries. DRC, for example, we still have a long way to go. But the fact remains that in the DRC specifically, we do have a lot of people who are well-trained, like experts in the field, good doctors, and we do have hospitals, we have good equipments, machines, etc., etc. But what we really lack, I think, is just a good organizational system. We don't have a system that works. So in that sense, I feel even if we pump in so much money and we bring in a lot of new partners and things, it will always be difficult to make things working, turn things around. So what we really have to establish, and that has to be done, I hope it's being done already. I think it's being done, but it will take a while, but it has to be done quicker, to establish a good public health system where we can have a good surveillance system, and we can have a good system where we search for solutions locally and understand how to implement that system in a way that will directly go and affect the life of the people directly. What we have so far is we are focusing, in the country, we focus a lot more in pumping money in and finding partners that bring in something, then they pump equipment in, they put in things in, but that's not really addressing the real issue. We do not have a system. So in my personal opinion, I feel that's what will make a huge difference. Having a good system to monitor and respond to challenges.
And that's a fascinating point, because I think that really comes down to leadership, and so important, I think, is the likes of Tueda, for example, and the work you're doing in Washington at the moment to establish trusted partners, where you can rely on agencies and individuals in leadership positions that will bring that expertise that can be shared.
Yeah.
So I suppose that's a really important point. If I just wanted to ask Zainab, the next generation, your generation, in terms of, you're really at the forefront of this in the medical paternity. Do you feel that there's an onus on you guys to step forward now? Like, I know we have Global Social Prescribing Alliance. We have a Champions Initiative starting up. Do you think that the youth are ready to take that responsibility to help Daquin and colleagues, Nasibo and others? Do you think that will is there from your generation?
Well, I think essentially what we need to do is strengthen the link to people who are diaspora. So especially, personally, I didn't have much of a link growing up to my home country. I was just living in London all my life, didn't much have anything to go back of. And every time I looked back to my home country, I did only think of, unfortunately, the way that it is now, without thinking the way that it used to be, without thinking about and actually pondering on how my parents and their parents lived there and the systems that used to work well, essentially. So again, back to what Daquin was saying, it's about those systems that are not there anymore. And once we can help build those systems, then we can start making the country back to the way it was again, and then start improving it more. And essentially what the diaspora are not thinking about as much is what will happen after those systems are there. When we have those systems, we will be a country again the way we used to be and more. And that's what's going to make people like us want to go back and help the country. So essentially, if we can get these systems going, more youth will be thinking about how they can go back and make a difference, essentially. And what will happen is the youth here are learning, and they're going to be, what's it called? I know it's called a brain drain when you leave, but I don't know what it's called when you come back. So the opposite will happen essentially once we get all the youth who are interested to come back and help into the country.
Brain gain.
Brain gain, yeah.
And wisdom.
Yes.
Yeah, it will be a big brain gain. And essentially what will happen is the youth will start to be more connected, and therefore it's just the connection is gone. So once we can get these systems built, the connection will be back. And I can be assured that the youth will want to be joining in as well. So yeah.
So let's bring Nazibu in on this, because he's an expert in this space, because he is an expat at Dysphoria. Tell us a little bit about what you're, because you grew up in Tanzania, moved to the UK, but you have aspirations to help back home. Tell us what you're doing, because you've got an event as well coming up at the end of this month, and just tell us from your generation's perspective, how do you see yourself as a leader in this position that you're in, being able to mobilize the youth and globally bring that back to Africa so that wisdom can be transferred back to help Dakwin and other colleagues? Where do you see that where do you see the opportunities there?
Thank you, Gareth. I mean, the opportunities are everywhere. I mean, everywhere there's so much opportunity. I think trust is the first thing we need to have, because sometimes there's a bit of friction between the people who are left back on the ground and the people in the diaspora. I mean, some of us, we seem like we ran away and they came this way. So when you suggest something, people think, well, because you're there, you don't know what's happening. But in actual fact, because I know, I grew there, and I know, I lived the struggle. I know what it's like to be ill and go to hospital. You cannot get to see a doctor, or you cannot get the medicine. I know that, and that our mission is just to try to bring back the good you can see village. Go, you to have a very good doctor and a dispensary. So, and I think, to me, I think the doctor should not to wait for people to come to them in those fancy buildings. I think the doctor should be out there, go to the community, and to help people build their health, and give them the right information, educate them, inspire them, and then empower them to look after themselves. And that's what Tuheda is doing. And all this cannot be done without the political will. Of course, you need to work with the government, and you need to work with the private sectors, and everyone have to be singing from the same page. And if we can engage the young people, even in primary school, in secondary schools, and I think if they see the benefit, they have to own the solutions, because the solutions are out there. So I think the investment and of our energy should go into the community, to the young people, to see that this is a mission to bring their community to be in a better position and health-wise.
So that's a good point, and I'm going to ask you the three of you for your some final thoughts around where you think we can go in the next 5 years, shall we say, from Africans' perspective. And I wanted to just ask Dakwin, because I wanted to come back to you, because just to start and also just pick up on a couple of things. And Naz just mentioned investments there, and Africa is a very rich continent and has plenty of resources in terms of being able to generate its own financial might and shall we say, drive that change. That's a big area, isn't it? And perhaps healthcare can be the leverage and can support a healthy well-being sector, which is an economy that drives health and well-being, which then of course drives economic growth. And perhaps that's the opportunity for Africa to embrace that, to keep their population fit and well. Do you think that that's an opportunity? And where do you think in the next 5 years can the DRC go? Because, all it needs really, as you kind of were talking about, was that structure. If we could get that right.
Yeah, thanks, Gareth. Those are really good key points that Nazab highlighted and Dr. Nasibu highlighted. Before I just come to your question, Gareth, I really liked what Dr. Nasibu said at the end, where he mentioned like maybe having a system where the healthcare professionals go to the people instead of having them working and finding the doctors. That's actually made me think of one thing, that usually we tend to feel that's okay, so this is the way it's done in the West, then if we just take this practice and import it in our country, then things will be better. But I think that's not the proper way of thinking. We should be able to find a way that works for us. It's good. I'm not saying it's bad, but most of the practices are really good. But sometimes with the situation on the ground, it's just not appropriate. So if we have, coming back to having a system that works, if we have a system that's really well formed and that works, we can be able to do some research and find out answers that are appropriate to the context. And coming back to the opportunities you mentioned, yes, I feel that healthcare, I mean, public health in general, could be a huge opportunity to generate a lot more wealth for the continent. Because, I mean, think of this, like Africa is mainly like the main, contributing the most to disease burden in the world. It's not a good statistic, but that means we have challenges. That means we have opportunities in there. We could transform these challenges and try to create platforms that help us turn these challenges into opportunities, and then generate resources that will help better improve the health of our people. And I always highlight one fact, that at the center of whatever reform we do, it must be the people, the African people at the center, driving the reforms and implementing them on the ground. So that means the real people on the ground, the population. So that's really key, I think. Otherwise, there will be a communication problem. We've seen this in DRC many times, many epidemics. We have epidemiologists that come to the ground on a small village where they don't speak English, they don't speak French, but the international experts come from, let's say, other countries. They speak French, they speak English, they can't speak local languages. Now they have to confront and speak with the people in the village. There is this clash and difficult to really understand what's really going on, and it takes more time to solve problems that could be solved quicker. That's basically my point, yeah.
And that's such an important point, and I think that leads to trust also, you know, in terms of, you know, building that trust. There has to be that genuine will to do the right thing.
I'm not, just to clarify, I'm not, okay.
Go ahead. No, please, go ahead.
Just to clarify, I'm not saying we don't need partners. It's very important to work with partners, because we are now in a world where we all have to interact and work together to solve problems. Because whatever we do, even if the DRC becomes the best country in the world, if other countries if we do not share our experience with others, we are not solving really any problem, because the world is a village now.
Totally agree with you. I mean, it's a global community, and we need to be able to find these solutions together, because regardless, you know, you look at the African basin, for example, the DRC has the second largest, I think, rainforest in the world. We need, you know, the agriculture system in the DRC to work effectively if we're all going to survive in terms of climate change. Zainab, if I come to you, just some final thoughts around Somalia, your vision. It'd be lovely to hear what you think can happen in the future, particularly around digital enablement, health literacy. Can that be an enabler to improve people's health and well-being? Can Somalia turn the corner and encourage people to stay fit and well? That ultimately will lead them to better mental health and well-being, which then, of course, leads to employment.
Yeah, so I just want to do a disclaimer again. I'm not an expert with anything that's going on in Somalia at all. So I will just give my thoughts as what I am doing in London. But again, it's about trust. And what we're doing with Isha is trying to push the slogan that it's made for Somalis by Somalis. And I think that once you can get that across, the trust there is going to be built once again, and people start to trust the information that comes from the government, information that comes from important health sources, doctors, clinicians, and stuff like that. And that's how we're going to start building the systems again. If you don't have trust, nothing is going to happen. And unfortunately, that is what's happening in many African countries. But again, it's a case-by-case situation. With Somalia at the moment, it's just about trying to get rid of the civil war. In another country, they might not have a civil war at the moment, but they do have a different crisis. And again, it's just about trying to target each country on its own and trying to figure out how to specifically set up those systems. So yes, for us at the moment, we're just trying to build that trust and encourage other people to build that trust as well. And then from there, we can try and make a change. So yeah.
I think that's a really important point. And also, but I think when you break it down as well, even from the future's perspective, if you look at cities, so breaking it down from even the country level to the city level, like Kinshasa, for example, and regions within the cities, perhaps that's the best way to go about positive change, so that you get that message locally and you work locally. Naz, final words to yourself, building trust, messages to the audience, some final words of wisdom will be appreciated. Tell us what you think the future can lead to for Africa and healthcare.
Okay, thank you, guys. I think the future for Africa, the way I said, I think it's brighter because we have, because the African people, they are very resourceful and very innovative in the way, because to live that environment and the thing that we do, people, they know how to think out of the box. So the main thing is just to appreciate those sort of creativity and the innovation that come from within the community and take it to the next level. Get the government to support the great minds in the community to bring those changes in our society. So, like my colleague said about trust is very, very important, because if people they don't believe what you're telling them, that nothing will happen. But I think, as I said before, change is meant to happen. It just doesn't happen. But I think for change to happen, that willingness should be there, and that should be the political will, because other people who run the government, they should be engaging, going to the people and then listen to the people to say, okay, guys, okay, what matters? What are your priorities? What do you want regarding your health? And because the health is an economical thing. Because if you're ill, it's going to cost you money to go to hospital. Even if you have insurance in Tanzania, for example, you still have to fork out a certain amount of money. The insurance doesn't cover everything. So staying healthy is very, very important, because it saves you money, you're healthy, so you can produce, you can feed your family, you can just see your life through. So I think the way I say it is, we need the government to work with the private sectors and engage the people to make the right decisions regarding their health. I think if we do that, I think we can be in a bit, because Africa is so rich. Africa is just rich, and you won't believe it.
Appreciate that. Listen, final words. That was the final words there. This has been WIS Talks. We've had a fantastic discussion on African healthcare. We'll have this as a podcast as well. You can find us all over the web in terms of www.wis.uk. Our SDG programs with the UNGSII Foundation can also be found online. Thanks to our guests who have joined us today. Those who have listened and watched, if you have any comments, feel free to chip in. And we look forward to working with you as we implement the Sustainable Development Goals. And so from ourselves here, we want to wish you have a great day. And we'll talk to you very soon. Our next WIS Talks will be scheduled in the coming weeks. And we look forward to welcoming our guests back as well to tell us how Africa is developing over the next couple of years. And stay tuned for more information. So thanks everyone for joining us, and we'll sign off. So thanks everyone. Bye-bye.
Thank you.